We've all seen the Life Alert commercial, "I've fallen and I can't get up." It has become something of a punchline, but seniors falling is no laughing matter. Health reporter Aaron Billups brings us more. Aaron.
Well, Bree, falls are a huge medical problem that the city and aging experts are trying to get ahead of by focusing on keeping our elders safe and mobile.
It was late at night. I was doing something in the kitchen. The next thing I knew, I was on the floor. But I have this Life Alert gizmo, so I pressed a button, and just as in the commercials, a voice from the speaker said, "Help is on the way."
Former Hofstra University law professor John DeWitt Gregory says a decade ago he never would have worried about falling. It was a surgery to remove an aortic aneurysm that changed his life.
After the operation, of course, I mean, it was like starting everything afresh.
More health complications popped up. Now the 86-year-old takes about a dozen pills a day to manage his illnesses. But the cocktail of prescriptions also increases his risk for falls. It's the leading cause of injury among older adults and accounts for $31 billion in hospitalization costs annually nationwide.
There's a very vicious cycle attached to falling that can lead to fear of falling again, which can lead to not wanting to move around too much, and that leads to muscle atrophy or getting weaker and your balance getting worse.
Physical therapist Sonia Rappaport visits seniors to make sure their homes are safe. She checks for trip hazards like high door jambs, loose rugs.
If someone had a real drag toe or drag foot, again, we might want to really tape it down.
Handles in the bathroom, seats in the tub are all necessary additions, and light.
They actually need about 3 times more light than someone that is not a senior.
And in order to remain independent and mobile, staying fit is crucial.
Walking sideways, marching, sitting, standing, all those activities build up your core strength, which helps with your balance.
All things Gregory has been working on, taking it slow to avoid another fall.
Breaking a hip is really disastrous. Now I can at least take my walker and walk around the neighborhood if the weather isn't too bad.
So, Bree, there are over 1.5 million seniors or folks over the age of 60 living in the city right now. About a quarter of them live alone, and you know, we need to make sure that the right safeguards are in place so they don't fall, because it is a vicious cycle, sort of a snowball effect that happens. Once you fall, other health complications arise.
Now, I think many seniors are, they should think of it as a sign of weakness if they ask for help, but these are really some easy, simple steps that they can take to help themselves and prevent falls from happening.
Yeah, I mean, and one of the things that helps keep seniors safe is staying social. So if you do have a neighbor who's older or a loved one, visit them, walk around their apartment. Oh, it's a little dim here, let's put some lights on. Think about moving things, coffee tables or trip hazards. If you have young kids and they're running around, a senior's place, kids are a trip hazard, so we just need to be cognizant and aware and kind of support each other, help out.
Great advice, Aaron Billups. Thanks so much.